Okay, welcome to foundational nutrition number 6, irritable bowel syndrome and SIBO, which is small intestine bacterial overgrowth. Irritable bowel syndrome is probably the most common GI complaint found by gastroenterologists. 10 to 15% of the population suffers with it, although a much smaller number have actually been diagnosed with it. And a lot of natural healthcare is backed by research. And I want you to think of this as one way of doing things, not the only way of doing things, especially with this set of tapes. It might be a little controversial. I took the protocol I'm going to use from Dr. Harry Eidner. I've used it a few times and it works really well. Sometimes I'll talk to somebody and they're horrified that I want to kill so many bugs, but it works, and there are other approaches. And you can explore those. But I wanted to give you something practical that you could use. Um, if you have an extensive background, this will give you context to what you're currently doing. And also, I want to say to lay people, please don't use this to self-treat. You don't know what you don't know. Um, there are a lot of different approaches. One thing that I've seen that works very well consistently with this is finding food sensitivities and getting rid of them. And some people like that as a gentler way of treating it. The other thing I'm going to say is Zorex is mentioned. I like Zorex because they're family owned. They're not a big corporate, that conglomerates are buying up these nutrition companies. And the other thing I like about that, they sell only to professionals, so it discourages lay people from treating themselves. If you're a layperson, please don't treat yourself. So now we're going to begin talking about the microbiome. The microbiome is the bacteria that grows in your intestines. There are more bacterial cells. Usually it's like somewhere between 5 and 7 pounds of bacteria in your bowels. But it's actually more cells, more bacterial cells than there are in your entire body. And this is a little bit of an oversimplification, but good bacteria do beneficial things. They produce vitamins, actually produce vitamins, B12 and others. They nourish the intestinal lining and keep it strong. They break down toxic materials and keep bad bacteria in check. Bad bacteria, once again, this is an oversimplification. They produce toxins. They'll even, when the liver packages things to be moved out of the body, they'll unpackage it and release the toxins. They irritate the intestinal lining and can eventually lead to something like leaky gut. They inhibit the growth of normal bacteria. Most cases of IBS and other digestive problems are due to issues with the microbiome. Symptoms of SIBO are basically the same as irritable bowel syndrome: abdominal bloating, distension, gas, diarrhea, abdominal pain. Sometimes you get constipation. In advanced cases, there may be vitamin and mineral deficiencies and weight loss. And there is a breath test for it. You provide an initial breath sample, you drink some glucose or lactulose. And you take samples every 15 minutes over 2 hours. And there's an analyzer that measures the amount of hydrogen and methane in your breath. And if you have a lot of methane and hydrogen, that means that the bacteria are in your small intestine. Also, 50 to 80% of irritable bowel syndrome, because it's diagnosed by symptom, right? 50 to 80% of irritable bowel syndrome patients actually have SIBO. So what causes the problem? Diet, of course. If you think about what you eat feeds the microbiome. And if you're eating good food and it isn't digested, then the food goes further down the line and it rots. If you're eating bad food, the old saying, text saying is GIGO, garbage in, garbage out. You're growing a microbiome that feeds on these terrible foods. And a lot of times that's why when you change your diet, you don't get the kind of result that you want because the microbiome's all wonky. In the roadmap to health, one of the things that is designed for is to grow a healthy microbiome. Lots of vegetables, a variety of vegetables. Goodhart even had patients make a chopped salad because get it into small pieces. Vegetable fibers feed a healthy microbiome, and a variety of it feeds more. So one of the things you want with your microbiome is you want it to grow very diversely. Okay. Not chewing your food can be a problem. Incomplete digestion in the upper GI. In other words, if you're not producing enough hydrochloric acid, I know that's that's controversial, and exocrine pancreatic insufficiency, which oddly enough medicine does recognize. But if you're not digesting your food, you're growing a funny microbiome. And of course, drugs cause the problem. Antibiotics kill what's down there, and whatever grows, grows. And it has a way of making for a lopsided microbiome. Antacid, uh, proton pump inhibitor. I keep saying protein pump inhibitors, um, like omeprazole, Prilosec, things like that, are directly linked to irritable bowel syndrome, and that's been studied and proven. And a lot of times you'll see a patient who's taken Prilosec, they're buying it over the counter and all that, and all of a sudden they start developing worse and worse digestive complaints that goes beyond just the burning that they were treating. Both SIBO and IBS are due to problems with the microbiome. One of the medical treatments is something called the FODMAP diet, and what they're trying to do with that is to deny food to the kind of bugs that are giving you problems. I'm saying this. It seems like a long way around the block to get rid of bugs. Why not just kill them and start over? And one of the reasons we know the microbiome is a problem is that fecal transplant, which sounds disgusting, but they take the stool out of the unhealthy person and they put stool from a healthy person in them. But that has actually been shown to reverse IBS, not as a treatment. I think they do that as an experiment. Okay. And these are the studies. If you contact me, I'll get you a list. I actually have a patient report that you can give to your patients. It's got a lot of the information that we're presenting here. It's all written up. I could send you a PDF. I could even put your practice information on it, and you can use it as a patient education piece. Okay, we're going to talk about the specific carbohydrate diet again. This was developed by Sidney Haas for celiac disease. Elaine Gottschall, whose daughter was a patient of Dr. Haas, found that it was very good for Crohn's disease and ulcerative colitis. In fact, about a third of the cases of those will get better simply with the diet. And if you think about it, Crohn's disease is probably SIBO that's gotten way out of hand. Okay, but what happens is you don't completely digest the complex carbohydrate, and Gottschall says it's because we eat too many of them. Half our diet is starch, and that's too much, which causes the wrong kind of bugs to grow and grow in the wrong place. Irritation of the small intestine. Mucosa, the lining of the small intestine is the cells are supposed to produce more enzymes, but you start damaging those cells, so you get even less enzymes. Okay, and that makes for more incomplete digestion, which gives you more flora, and she calls it the vicious cycle. So avoiding complex carbohydrates is a good thing. We've got the Roadmap to Health diet, which you can email me. I'll send you a copy. Except I would tell them if they are IBS or SIBO patients, the Roadmap to Health does allow quinoa and sweet potatoes. I would tell them not to eat those. Another thing that I think is helpful is sometimes if you take some pancreatic enzymes. And the specific carbohydrate diet has been studied and found to be effective against inflammatory bowel disease, which is colitis and Crohn's disease. And especially pediatric patients have been studied. So this is a valuable tool. Okay, so what I'm going to give you is the protocol from Dr. Harry Eidner. I've used it; it works. Harry's approaches to kill what's down there and start all over again really seems to help. There are people that don't agree with this. I'm presenting the material. If you want to use it, use it. This is one of the reasons I'm saying if you're a practitioner, follow this. Or use it as you see fit. If you're a lay person, find a good practitioner. Okay. So Saccharomyces boulardii has been used to treat inflammatory bowel disease all by itself and other intestinal infections. It will crowd out other microbes in the GI tract and when you stop taking it, it disappears. Although I have talked to one practitioner who says every once in a while it stays. Okay. Olive leaf not only kills bacteria, but it supports the immune system. Berberine will kill undesirable bacteria. But it doesn't seem to bother the good guys. Okay, it has been used to treat colitis. Emulsified oregano oil is one of the most powerful natural substances to kill undesirable bacteria. Iodine is also used as an antiseptic and is researched as an antimicrobial. So basically, we're going to take stuff to kill the bugs. And once again, here's the studies. I have this in a report that you can give to your patients. And Harry was a big believer that low carbohydrate is especially good, especially if they got to lose weight. He says 80 grams of carbohydrate a day, and you can find that list on foods. Not that they're going to eat potatoes, but a small potato is 20 grams of carbohydrate. Follow the roadmap to health. That's what I like them to do. Although I would take away the yams and the quinoa because you want to follow this specific carbohydrate diet. So even if you don't go with low carb, you do want to have no complex carbs for these patients. Okay, so this is Harry's protocol for IBS and SIBO. He has the patient take 4 organic oil caps 3 times a day, 1 berberine 3 times a day, 2 olive leaves capsules 3 times a day, and you do that for 2 weeks. And then for a week, you give them just Saccharomyces boulardii once, twice a day. And you do this for 3 cycles. And then after the 3 cycles, you follow up with a probiotic and a prebiotic for 60 days. Now, Harry's original protocol includes HCl complex, which is hydrochloric acids for hypochlorhydria, and Ki caps, which is it has selenomethionine in it, which is good for the thyroid. But it's 80 times the RDA, which is one of the reasons I don't want lay people following this. You can contact me if you want to know more about it. I tend not to use that, and I've done well without the Ki caps. But 3 cycles and then follow up with a probiotic and a prebiotic. And this is something that was interesting in the news that I just found out recently, but apparently they did this in 2020. There's a Professor Brody and his team found specific antibiotic combinations and fecal transplant would cure Crohn's disease. So, they're basically recommending the same thing we are: kill the bugs and get new. I mean, fecal transplant I don't see as a practical therapeutic thing, but what they're doing is they're proving that the microbiome is the cause of not only inflammatory bowel disease but irritable bowel syndrome. So things that go wrong down there very much because of the microbiome. Like I say, there's other approaches. There's Oxford Labs, which does food sensitivity testing, not food allergy. This is a different thing. They expose the blood to foods and see if inflammatory signs show up in the blood, and then they will remove those foods from the diet. So it's a very elegant thing. They test 176 foods, and then you're only allowed foods that have tested not inflammatory. So if they didn't test it, you still stay away from that food. You eat only foods that have been tested and proven safe. And then once you go through 30 days, you can start adding foods and see how you do. And they've been treating these irritable bowel and things like that with this approach. Dietitians are starting to do it, which is interesting. They've got a kind of a medically based group who've been criticizing the concept of food sensitivity for a long time, and now they're doing it. But what's nice is they have a test. The test seems to be effective. You can contact me. I'll tell you how to get a hold of people that can get you to Oxford Labs and help you with the test. It's interesting that this quote was from Voltaire. Voltaire was he had all kinds of health problems. He had this dyspepsia. He had chronic bronchitis and febrile attacks. Some people thought he was a he had insomnia. You know, some people thought he was a hypochondriac. Okay. All right. And if you need help or any of the materials I've mentioned, Roadmap to Health, whatever, you can email me, paulgvarnes at gmail.com. Contact Zorex. If you order, if on your first order, they will give you free shipping if you use the code PV10. Okay. Okay, our next video video will be foundational nutrition number 7. Diets make you fat. It'll give you some strategies to help your patients to lose weight without dieting. Actually, dieting makes you fat. See you next time.